Renowned Kenyan gospel singer Betty Bayo has tragically died of acute myeloid leukemia at the tender age of 43 years old. And I send my sincere condolences to the family, friends, and anyone who was close or knew her. At this time of your life, when you hear of incidences like this, I'm sure it clocks in that it's not just something that just happens to other people, but it's something that can happen to you and me. And that's why you need to start talking about such topics, the warning signs, how you can prevent it, how it's treated, what to expect. And of course, this information should be available to you freely and in an accurate manner. In that case, my name is Dr. Linda Biomdo, and I share informative medical videos on my TikTok page every single day. If you find this video informative, click on that follow button. The kind of blood cancer that Betty Bayo had is called acute myeloid leukemia. There are different types of blood cancers, and they can be classified into leukemias and lymphomas. Leukemias can further be subclassified into acute myeloid leukemia and acute lymphocytic leukemia, also chronic myeloid leukemia and chronic lymphocytic leukemia. What Betty Bayo had is the worst form of blood cancer, in my opinion, as a medical doctor. I actually know world-renowned Kenyan medical doctors who have worked and practiced for more than 20 or 30 years in their careers, who at a certain point in their careers decided that they were not going to treat acute myeloid leukemia because of the high morbidity and mortality rates. I think, if I'm not wrong, it's the same kind of cancer that killed Bob Collymore, the former Safaricom CEO. Blood cancers usually originate from the bone marrow. In an adult, the bone marrow is responsible for the formation of new blood cells. What usually happens in acute myeloid leukemia, what Betty Bayo had, is that the bone marrow starts producing a lot of immature blood cells, which are abnormal, and they end up taking space for the other blood cells that are produced by the bone marrow, including platelets that are usually responsible to stop bleeding anytime you get cut or an injury, and other white blood cells that are usually responsible to protect you from getting infections. So what are the signs that you could possibly be having a blood cancer, or what should prompt you to seek medical attention immediately? The reason why I'm sharing this is that AML is very fast moving. It can progress in a matter of weeks to months. However, it can be treatable, especially if it's caught early. So it's very important that you know the signs and symptoms of possible blood cancer so that you can seek medical attention early before it progresses, so that you can benefit from chemotherapy among other treatments before it's too late. Some of the signs and symptoms of AML, among other blood cancers, can be very vague, and if you have any of these signs and symptoms, it might not necessarily mean that you have the blood cancers. It should, however, prompt you to get medical attention just to be safe, to screen that you do not have a blood cancer. The first is unexplained fatigue and weakness. Most of these patients tend to have anemia. Your body becomes weak and fatigued. And on top of that, you start having fevers. Fevers is hotness of body. And I realize that for so many people out here, I keep on saying this, especially mothers with their young children. Anytime their child starts having fever, you start thinking of a bacterial infection, even if there are no other signs that you have a bacterial infection. And that could have been the first sign that you could possibly be having a blood cancer. Because apart from infections, people with blood cancer tend to have unexplained fevers or hotness of body, coupled with extreme fatigue, weight loss, and weakness. And of course, if you have anemia, you'll tend to have pale skin or pallor, such that the palm of your hands, the sole of your toes, the conjunctiva of your eyes tends to become really pale or white. The other signs include a tendency to be having recurrent infections. Infections can be the normal pneumonia, recurrent UTIs, among other genitourinary tract infections, recurrent ear infections. And if you have a wound, this wound tends to not heal, right? There's usually B symptoms of cancer that is not just limited to blood cancers, and that includes unexplained weight loss. Usually it's drastic weight loss over a period of 6 months that you have not changed any of your bowel or feeding habits, but then you're having this weight loss. At night when you sleep, you have drenching night sweats. You wake up in the morning and you just feel like you've been sweating a lot. And the others, of course, is the paleness, the fever, the fatigue, weakness, generalized body malaise. And as a medical doctor, the cases that I have seen so far, most of the time what is pathognomic of blood cancers is that they will tell you that they have a tendency of easy bruisability or bleeding. Do you get injured? And when you start bleeding from the place that you have been injured, let's say the wound, right? You hold it, but then when you remove your hand, it takes longer for the bleeding to stop as compared to other people or as compared to previously. That can be a sign of platelet deficiency. For other people, they tend to have purple-like lesions on their skin surface, and this might not be very prominent if you're dark-skinned like me, but then I still see it, right? You have purple lesions. That just shows that you're bleeding on the subcutaneous tissue, right? So if you tend to have a tendency of easy bruisability or bleeding when you brush your teeth, you have bleeding gums that was not there before, and then you can also have nose bleeding that keeps on happening more often, that can be a sign that you're having a blood cancer, and you should actually go to hospital, get a CBC, a basic full hemogram test that is very affordable, that can show whether you actually have a blood cancer or not. The other signs and symptoms include swollen lymph nodes, especially if it's a lymphoma. In cases of myeloid leukemia like Betty Bio, usually they don't have swollen lymph nodes, and lymph nodes can be literally anywhere in your body. I'll just show you the place where you can actually check by yourself in case you think that some of these signs and symptoms apply to you. So there's usually the submental lymph nodes, you have the submandibular ones, you have preauricular, postauricular, occipital, you can also have supraclavicular, infraclavicular, in the axilla, and then you can also have inguinal moving forward, right? So if you tend to touch yourself on all these areas that I've actually just explained and showed to you, and you feel like there are swellings, in some cases the swellings can be tender or it can be rubbery, and it can also be non-tender. If you have those swellings, that can also be a sign that you could be having a type of blood cancer. Most of the time, it's usually lymphomas. Go get tested. Do not sit down and wait for you to get really, really sick. Just go to the hospital and be screened. I promise you it's worth it, because most of these blood cancers, when caught early, they're completely treatable. For other people, and I also tend to see this as a pathognomic phenomenon when it comes to blood cancers, is that they have organomegaly. Organomegaly is where, for example, on your left side, you have your spleen of your abdomen, and then on this side you have the liver. So they tend to have enlarged livers, and others tend to have enlarged spleens. Ideally, if you touch yourself on this aspect of your abdomen, you should not palpate anything. Like, it should just feel like, you know, there's muscles, but you don't feel like a mass. But if you palpate yourself on the left side and you feel like there's a mass, and if you come to the right side also and you feel like the liver has enlargement, that is what we call hepatomegaly and splenomegaly respectively. You should get tested. Depending on the time that you watch this video, seek medical attention almost immediately. And in my opinion, if you live in Kenya or any third world country, I don't think it's worth going to a level 3 facility and below. If you can go to a level 5, level 6 facility where you have experts and specialists who can investigate further to determine the specific type of possibly blood cancer that you have and the treatment regimen, so that you can be started as early as possible before it gets too late. And for the ladies, the frequent bleeding and easy bruisability can also be linked to heavy menses. For some people, they start seeing blood in urine. If you see that, that can be a sign of a blood cancer, especially if these things never used to be there before. And most of the times you have to couple all these signs together. For some people, they have very minimal signs and symptoms, and others, they literally have all of it like a textbook picture. So it's very unpredictable. So if you can just go to hospital and get screened, to be honest, I believe it's worth it. Of course, there are other signs and symptoms, but I was trying to share with you the most common ones. What usually kills most of these patients is the recurrent infections and the lack of blood. If there's something that you can do that is noble in your life, that you can actually impact people out there, is to wake up and go to the nearest blood donation center, donate blood. I promise you, the number of people with blood cancers and people with just blood disorders that need blood, as we're speaking right now, I have patients in the wards, many patients who are struggling to get blood. Go to the nearest blood bank and donate. I'm sure that at some point Betty Bio needed transfusion. These people usually need multiple blood transfusions to get them through chemo. And sometimes the blood is usually so low that they cannot even be started for chemo. And in such instances, the cancer continues to progress. Yet if they'd gotten blood earlier, then they would have been able to start chemotherapy and literally destroy this cancer. I send my condolences to the family and friends of Betty Bio. I hope you find this video helpful and informative. And in other news, we have been nominated to be the Social Media Doctor of the Year. The link is literally on the bio of my TikTok page. Log in there and vote for us. Thank you for watching this video to the end. I hope I'll see you in the next video. Bye.